Part of a therapeutic treatment plan is always turning on muscle groups that aren't working. And people like to think of muscles like the bicep, big, strong muscles, which we do have. We have some big, strong ones in the back, but we also have all these little guys, these little muscles that move from one segment to the segment above, or maybe up two or even three segments. They're just not all long, long muscle groups like your bicep. These little guys are important. That's what stabilizes the spine. That's what prevents the shifting. That prevents the damage to happen to the facet joints or disc. The better we can control the spinal segmental levels, the less wear and tear we're going to get. But with people who start getting inactive or injuries, these muscles stop doing their jobs. The big guys try taking over and they don't do a great job. They get by, but they don't do it well. That leads to excessive shearing. The shearing damages tissues and joints. And then years later, we're looking at somebody with chronic low back pain. They get an MRI report that talks about muscle atrophy or even fat infiltrate. And that's a sign that these muscles just are not doing their job. It's been a long history of them not working, and they're breaking down. They're getting weaker, and they're having the fat get in there that shouldn't be there. So part of our job in rehab is building up strength, endurance, but getting these little spinal muscles to start engaging, start turning on again. If they can control the spine, we're going to have a lot less injuries and a lot less damage long term. So the treatment is going to just progress from basic stabilization exercises, but then always getting a little bit harder. So you're challenging yourself to get these guys functioning as well as they can to protect the low back for long term.